All right. So you sent over this article, the intersubjective and the intrasubjective in the patient-physician dyad.
Yeah.
And wow, it really got me thinking.
Yeah.
Basically, it's saying that like doctors and patients kind of create meaning together, which, maybe sounds obvious at first.
Right.
But when you really think about the implications, it gets
pretty deep, yeah.
really fascinating.
Yeah, and what's really interesting is how this challenges the idea that medicine is just purely objective science.
Right.
Of course science is like the foundation.
It has to be right now.
Right, but this article is saying that actually practicing medicine, out there in the real world,
Right.
it involves like this constant back and forth between different perspectives.
And they use a really good example, diabetes.
Right.
We tend to think of managing diabetes as like,
just follow the science.
yeah, just follow the science.
Yeah.
But the article brings up all these other factors.
Right.
That,
you have to deal with in real life.
in real life, exactly.
Yeah.
Like, it's not so simple.
And they actually point out that those textbook solutions,
Oh,
which
right.
are like, really intensive insulin therapy,
Yeah.
it may be scientifically valid, but often it doesn't take into account like the practical realities of people's lives.
Okay.
Like imagine someone who's struggling with literacy
Right.
or can't afford healthy food.
Yeah.
Or, can't even keep their insulin refrigerated because they don't have stable housing.
Yeah, that makes total sense.
And suddenly those scientifically correct solutions,
Yeah.
they're almost impossible to actually implement.
And that's where this concept of intersubjectivity comes in.
Right.
And honestly, it took me a minute to wrap my head around it.
Yeah, it's a mouthful.
Yeah.
But in simple terms, it basically means that knowledge, especially in medicine, it's not just this like objective truth
Yeah.
that's just out there waiting to be discovered.
Right.
It's actually created in the space between people.
In this case, the doctor and the patient.
So instead of the doctor just like delivering the facts to the patient,
Yeah.
it's more like they're working together.
It's a collaboration.
Yeah, to figure out.
Yeah, to try to understand the illness
Yeah.
together.
Yeah. That's really interesting.
And to really get how this plays out,
Yeah.
we should unpack a few other concepts the article talks about.
Okay.
So, for example, think about how a patient's experience of chest pain, it only really becomes like heart pain
Oh.
once a doctor diagnoses it.
Oh, okay. Interesting.
Right. So that act of naming it,
Yeah.
Right?
And labeling it.
that transforms its meaning
Oh, wow.
for both the patient and the doctor.
That's a really good point, and it ties into this whole idea of the
Yes.
body as a text and a speaker, which, to be honest, sounded a little weird to me at first.
I can see why.
Yeah.
But think of it this way. The body is not just an object, to be examined.
Right.
It's always communicating information.
Yeah. Not just about the physical symptoms,
Right.
but about the person's whole life.
Okay.
Like their emotions, their social circumstances, even their past experiences.
Okay, so it's like,
It's a living, breathing storybook.
yeah, and the doctor needs to learn how to read it.
Yeah.
But how do they do that?
Right.
It's not like there's a literal language.
Well, there is language involved.
Okay.
And that's where things get really interesting.
Okay.
So this article, it brings up the work of this scholar named Bakhtin,
Right.
and he studied something called speech genres.
Okay.
And basically, it's the idea that we use different ways of speaking. Depending on the context, we talk to our friends differently than we talk to our boss.
Oh, yeah, totally.
Oh,
like there's
right.
friend language and there's boss language.
Exactly.
Yeah.
And Bakhtin argues that doctors, because of, all their training and being immersed in the medical world,
Right.
they often use a way of speaking that patients just don't understand.
It's like trying to discuss quantum physics
Right.
with someone who's just learning basic math.
Exactly.
Yeah.
And it doesn't matter how brilliant the doctor is.
Yeah.
If the patient can't understand what they're saying,
Yeah.
there's going to be this disconnect.
It's not going to work.
Right. And the article actually cites these studies
Oh, wow.
showing how the exact words a doctor uses can actually influence a patient's understanding
Really?
and even their expectations for treatment.
Wow.
So imagine being told you have bronchitis versus a chest cold.
Okay.
Even if medically they're like the same thing.
Yep.
Those words
Yeah. Yeah. But
they carry different weight,
they feel
Kind
different.
of different connotations.
Yeah, for sure.
Yeah.
Wow. So even small choices in language
Yeah. Can have a big impact.
could have a huge impact. Okay.
And then just to make things even more complex,
Okay.
the article talks about this idea of the intrasubjective.
Okay.
And this is where things start to get really mind-bending.
Right. I'm ready.
Okay. Yeah, it really makes you think about how we see healthcare.
Yeah.
It's not just about, like you said, following the rules
Mm.
or like, just sticking to some protocol.
Right.
It's about really seeing each patient
As an individual.
Yeah, as a unique person.
Yeah.
With their own needs and perspectives.
And you brought up a really important point.
Yeah.
At the end of the last part.
Mm-hmm.
About how a doctor's personal experiences could unintentionally affect their care.
Right.
Like we all have biases.
Of course.
So how do we make sure those biases don't end up hurting the patient?
That's a really important question. And the article actually talks about this.
Okay, good.
It's not about pretending the doctors are like these perfectly objective beings, with no personal beliefs or values.
Right. We're all human.
Exactly. We're all human. It's more about being aware of those biases.
Okay.
And actively working to, make sure they don't affect your decisions.
So it's like doctors need to be constantly checking themselves.
Mm-hmm. Kind of like a self-check.
Yeah.
Making sure they're not letting their own assumptions cloud their judgment.
And that goes back to what we were saying about those speech genres.
Right.
I remember that example from the article.
Yeah.
About how patients react so differently to hearing they have bronchitis versus a chest cold.
Right.
Even if it's basically the same thing.
It's a great example of how, even subtle differences in the words you use can really change how a patient understands things, even how they feel about it.
It's true. I've definitely had times where I left the doctor's office feeling more confused than when I went in.
Yeah.
Because they were using all this medical jargon.
Right. It's like a whole different language.
Yeah. And I had no idea what they were talking about.
And that happens all the time.
Really?
Yeah. It really highlights how important clear communication is in medicine.
Yeah.
And it's not about dumbing things down.
Right.
But it's about meeting the patient where they are.
Yeah.
And using language that's accurate.
Right.
But also makes sense to them.
It's like being a teacher.
Exactly.
You have to kind of adjust your style depending on the student.
Right. You have to know your audience.
Yeah.
And that's where this idea of intersubjectivity can be so helpful.
Okay. How so?
Well, it encourages doctors to see their patients, not just as passive recipients of information, but as active participants in this process of figuring things out.
So it's not just about the doctor explaining things clearly?
Right. It's more than that.
Yeah.
It's about creating a space where the patient feels comfortable.
Right.
Asking questions.
Yeah.
Sharing their worries.
Yeah.
And even, explaining how they understand their own illness.
So it's like a back and forth.
Yeah, real dialogue where both people feel heard and respected.
And I imagine that's especially important with chronic illnesses, like diabetes,
Right.
where the patient is involved in their own care every single day.
It's ongoing.
Yeah, it's not just a one-time thing.
Exactly.
It's like making lifestyle changes and managing things long-term.
That's why this shift toward a more holistic approach to medicine is so important.
Yeah.
Remember how the article talked about understanding the patient's social and economic situation?
Yeah.
Well, with diabetes, that could mean thinking about things like...
Like what?
Like their access to healthy food.
Yeah.
Can they afford their medication?
Right.
Do they have safe places to exercise?
Yeah, these are all really important factors.
Yeah, it's recognizing that healthcare doesn't happen in a vacuum.
Right.
A patient's ability to manage their diabetes, it's going to be affected by where they live.
Totally.
Their finances, even their support system.
That makes sense. And this all really emphasizes how important it is for patients to feel like they can speak up.
Advocate for themselves.
Yeah, and share their whole story with their doctor.
Yeah, and that can be hard for some people, of course. Especially if they're already feeling vulnerable.
Right, or intimidated by the whole medical setting.
Yeah, it's a power dynamic.
Yeah.
That's why it's so important to have a healthcare system that encourages trust and open communication.
Right, it's not just about individual doctors trying their best.
Exactly.
It's about the whole system being set up in a way that helps patients feel empowered and make sure their voices are heard.
And that leads us to another interesting idea from the article.
Okay, what's that?
The power dynamics in the doctor-patient relationship.
Oh, yeah, that's a tricky one.
It is a little delicate,
Yeah.
but it's definitely worth talking about.
Okay, ready.
So traditionally, the doctor has been seen as the expert.
The authority.
Right, the one with all the knowledge and the power to diagnose and treat.
But this concept of intersubjectivity it kind of challenges that.
It does. It suggests that both the doctor and the patient have important knowledge and expertise to bring to the table.
So it's less about doctor as expert and more about doctor and patient as partners.
Exactly, working together.
Yeah.
And that means both sides have to be willing to give up a little control and be open to a more collaborative approach.
And I imagine that can be tough.
It can be.
especially given how things have always been in medicine.
Yeah, there's a long history of power imbalances.
Right.
But this shift is so important for creating a healthcare system that truly puts the patient at the center.
And that's where that cyborg metaphor comes in, right?
Yes, exactly.
This idea from Donna Haraway.
It really challenges how we think about those categories.
Yeah, like doctor and patient.
Right. It's not so black and white.
It's more complex than that.
Much more.
Yeah.
It suggests that we're all interconnected.
Yeah.
And constantly influencing each other.
So it's like acknowledging that the doctor is also a person.
Mm-hmm.
With their own life and experiences.
And the patient is an expert in their own body and their own life.
It's like recognizing that shared humanity.
Yeah, and that can lead to more empathy and understanding on both sides. It helps us move beyond just the transactional part of healthcare.
I like that.
You know, and see the potential for real connection and collaboration.
It's beautiful like a dance.
Yeah.
Where both partners are moving together.
Mm-hmm. Responding to each other.
Yeah.
Creating something new.
That's a great image.
And it shows how powerful this idea of intersubjectivity can be.
In healthcare.
Yeah, it's not just about better communication or happier patients.
Right.
It's about fundamentally changing how we approach healing and well-being.
It's about seeing the whole person.
Yeah, the whole person.
Not just the disease.
Exactly.
But before we get too philosophical,
right,
maybe we should bring it back down to earth a little bit.
Okay.
And talk about some practical takeaways for our listener.
Yeah, good idea.
Like, how can all this abstract theory actually help people in their everyday lives?
That's a really important question. And the article does offer some suggestions for both doctors and patients on how to actually put these ideas into practice.
Perfect. I'm ready to get practical.
All right, let's do it.
Okay. So we've been talking about this idea of intersubjectivity.
Right.
And you know how it can change the relationship between doctors and patients.
Mm-hmm.
But before we wrap up, I want to go back to something from the article that really stuck with me.
Okay.
This whole concept of the body as a text and a speaker.
It's a powerful image.
It is.
Yeah.
It sounds kind of poetic.
Mm-hmm.
But what does it actually mean for patients, you know, in real life?
Well, it challenges us to see the body as more than just a bunch of organs.
Okay.
It's an active part of communication.
Really?
Even when a patient is unconscious, their body is still telling us things.
Like what?
Vital signs, physical responses, even small changes in their expression.
So even if the patient can't say what they're feeling, their body is still sending out signals. And a doctor who can pick up on those signals, they can learn a lot.
They can see things they might have missed otherwise.
So it's about going beyond just checking off a list of symptoms.
Yeah, it's about really paying attention to the whole person.
To all the little details.
To the nuances.
Yeah, okay. But how can a patient help their doctor read their body?
That's a good question.
Like, we can't control those subtle signals, can we?
Not really, but that's where trust comes in.
Okay.
And open communication.
So if a patient feels comfortable sharing their whole story, including, you know, their fears and their anxieties.
Yeah, even past experiences.
It can help the doctor make sense of those physical signals.
It gives them context.
Yeah, so it's not just about saying what hurts.
Right.
It's about sharing the whole emotional and social context.
Exactly. You have to help the doctor see the bigger picture.
And that brings us back to intersubjectivity.
Full circle.
It's not just about the doctor interpreting the patient's body. It's about creating meaning together.
A shared understanding.
Through a conversation where the patient's expertise is valued.
Their knowledge of their own life.
Right. And that goes back to that diabetes example.
Yeah.
It's not enough for the doctor to just know about blood sugar.
Right. They need to understand what the patient is dealing with every day.
With their diet and exercise.
Managing their medication.
Affording their medication.
And navigating the healthcare system.
All of that.
It's a lot.
And that understanding can only come from listening to the patient.
Really listening.
Asking the right questions.
And recognizing that the patient is the expert on their own life.
This makes me think about how important it is for patients to feel like they can speak up for themselves.
To advocate for their own needs.
But that can be scary.
It can be.
Especially when you're dealing with a serious illness.
Or just feeling vulnerable.
Do you have any advice for our listener on how to be a better self-advocate?
One thing that can really help is to come prepared to your appointments.
Okay.
Write down your questions. Bring a list of your medications. Maybe even bring a friend or family member for support.
That's a great idea.
Yeah.
It's easy to feel overwhelmed at the doctor's office.
It can be a lot to take in.
And it's okay to ask for clarification.
If you don't understand something, or if you feel like your concerns aren't being heard.
You have the right to be involved in your healthcare decisions.
Absolutely.
It's about being a partner in your care.
Not just a passive recipient.
Working together with your doctor to figure out the best approach.
Exactly. And it's important to remember that finding the right doctor for you, it takes time. Not every doctor-patient relationship is a good fit.
Right.
It's worth it to keep looking.
Until you find someone you trust.
Someone who listens to you.
Someone who makes you feel comfortable asking questions.
Exactly.
So it's not just about finding the smartest doctor.
Right.
Or the one with the fanciest degrees.
It's about finding someone you connect with.
Who sees you as a person.
And who respects your perspective.
This has been such a great conversation. We've covered so much.
Yeah.
From intersubjectivity.
And the power of language.
To patient empowerment.
It's all connected.
As we wrap up this deep dive, what are some key things you hope our listener will take away from this?
I hope this conversation has made people think differently about the power dynamics in healthcare.
Yeah.
And embrace the idea of a true partnership between doctors and patients.
It's about recognizing that you're not just a patient.
You're a person.
You're an active participant in your own healing.
And that healthcare is a human experience.
With all its complexities and nuances.
And the potential for real connection.
And with that, I think it's time to let our listener continue this exploration on their own.
Yeah.
We've given them a framework.
Some key ideas.
And hopefully a sense of curiosity.
Now it's up to you, dear listener.
To apply these ideas to your own life.
And your own healthcare experiences.
Until next time, keep questioning, keep connecting.
And keep diving deeper.
Into this fascinating world of knowledge and understanding.